Right, thank you for tuning in today. Our topic today is low common ankle sprains, the garden variety ankle sprain that lots of people do when they're playing soccer. They do on the edge of the sidewalk. They do even when they're dancing. So we're going to go through today the mechanism, the associated injuries, whether you need physio or not, if you need to wear a brace to reduce ongoing sprains, and when you can return to sport, and most importantly, if you need an operation. So thank you for listening to the Foot and Ankle Orthopedic Surgeon. Please make sure you subscribe or comment on our videos. And once again, the topic today is low ankle sprains. So we're going to get right into it. Now, when we talk about sprains, as we've said before in our video on syndesmotic injuries, there are two types of sprains. There are low ankle sprains, which make up about 85% of injuries, and then there are high ankle sprains, which make up about 15% of injuries. Now, the high ankle sprains are what we term syndesmotic injuries, and we have another video on this. They're more sinister, they're less likely to get better, and they more often require surgery. In saying that, in contact sports, the figure goes from 75% to 25%. So syndesmotic injuries are more likely in contact sports. Now, this is our diagram of the ankle. Looking at it from the front, we're going to label here the shin bone, which is the tibia with that arrow there, and next to the tibia is a small bone known as the fibula, which makes up the knuckle on the little toe side of the ankle. It takes about 1/8 of your weight, and is certainly you're able to feel that in the outer aspect of your ankle. And then we're going to mark the heel bone, which is otherwise known as the calcaneus, which is what you walk on. Now, the ligaments in red here are the syndesmotic ligaments, as we've covered in one of our previous videos, but the ones we're going to talk about today are the ligaments in green there. They're the ligaments known as the ATFL and the CFL, and they are commonly involved in a low ankle sprain, which is the topic we're talking about today, where you essentially roll your foot in and put those ligaments on tension. And we're going to come up in this next slide here to show you a picture of what your foot actually looks like when you suffer this injury. So here's our picture here. So the foot is rolling in, the big toe is going up, the little toe is going down. It's what's known as an inversion injury. So the foot rolls in, and we're just going to mark here that those ligaments on the outside, they're going to be put under tension. All that stuff on the outer aspect of the ankle is on tension. Now, this is a play-by-play of someone rolling their ankle playing cricket on a boundary road. So when the foot's pretty flat to the ground, that diagram looks much the same as it's on the other slide. In this video, the foot's starting to roll in, and hence our diagram shows that the heel is actually starting to move towards the big toe side of the ankle, and the ligaments on the outside are being stretched. In the next frame, we've got a poor video of the foot really rolling in, but we see the heel really moving towards the big toe side there, and those ligaments are pretty well ruptured, or at the very worst, very stretched. So you can certainly see that in a play-by-play there, and that's what happens to most people's ankles when they do what's called a low ankle sprain. Now, this diagram shows you where you're going to be most sore. So where you're going to be most sore is where the arrow is pointing to currently. That's just below the knuckle known as the lateral malleolus on the little toe side of your foot. Unfortunately, with these injuries, you're often sore in many other places. So in about 60% of cases, you're also sore over the syndesmosis, even though you may not have a syndesmotic injury itself. And in about 40% of cases, you're actually sore over the other side of the ankle in an area known as the deltoid, which is on the big toe side of the ankle. And look, if someone examines you in the first 48 hours after the injury, it would be very difficult to work out exactly where you're sore. So it's actually better to be seen around about the 5 or 7 day mark. It's much clearer for the doctor to work it out. Now, doctors really like their gradings of injuries. You often hear that on TV or in the newspapers. Unfortunately, with this type of injury, the grading's not that useful. Basically, a grade 1 injury means everything's pretty good. So there's minor swelling, minor tenderness, not a lot of functional loss, not a lot of instability. And grade 3, which is the worst grading, means that there's a lot of swelling, there's a lot of tenderness, you may not be able to walk on it, and the ankle often feels unstable. The good thing is that no matter which grade you've got, the treatment is much the same, and no matter what grade you've got, none of them are really likely to result in surgery. None of them indicate you need an operation. So, in terms of treatment is usually with something called police therapy. Now, it doesn't involve the police, but it gives us a good guide as to what needs to be done. So, starting with a P means protection. So what that means essentially is, ideally after you do an ankle sprain, if you're going back to training or returning to sport, or the incident that did the injury, it's good to wear an ankle brace. It reduces your chance of spraining again. We then talk about optimal loading, and optimal loading basically depends on how bad the injury is. So if it's quite swollen, very sore, we'd advise you to be off it for 4 or 5 days. If it hasn't got much pain, then you can actually start walking on it. And in severe cases where it's really, really painful, it's worth using a moon boot for up to 2 weeks. Ice is excellent for first aid no matter what the injury is, and that's useful in terms of getting down the swelling. And then compression is also an aid to reducing the swelling in the lower limb. The best thing to do with swelling though is elevation, so keeping it up above the heart on 2 pillows is excellent, whereas if you have it down for 10 minutes it really is likely to swell up like a pumpkin. But the crux of the treatment for a low ankle sprain is aggressive physiotherapy, and that involves range of motion in order to bring the ankle back to a similar range of movement of the side that is not injured. It also involves strengthening, so working on those muscles and tendons on the outer aspect of the ankle to reduce your risk of spraining the ankle again. And then lastly, it involves something called proprioception, which is knowing where your limb is in space. I'm going to go through that very shortly, but that's an essential component of your rehabilitation. Things that have been shown to be not particularly effective in the medical literature but are still done by many medical providers are things like low intensity ultrasound. Now it's not likely to be harmful, but it's likely to hit you in the hip pocket in terms of cost, and it probably hasn't been shown to be much benefit in the medical literature for it. Laser therapy is another one of those therapies that is similar to low intensity ultrasound in terms of its effectiveness. And then the last one that's not been shown to be super effective is electrotherapy. So whilst they're not going to cause any problems, it's probably better to stick clear of those. Now, proprioception, as we mentioned before, is knowing where your limb is in space. And here's Super Steve here on the right. He's got his hand up, but he is looking straight forward, meaning he knows where his hand is, but he can't actually see it. And that is what proprioception is. It's knowing where your limb is in space, even though you can't see it. Now, for whatever reason, your ability to do that once you have an ankle injury is reduced. And so the physios will work on getting you back to having that function. Now, in terms of return to play, the average layoff in professional soccer players at least is about 7 to 18 days, and the majority of professional athletes will get back to their sport in about 4 weeks. However, most of us don't play for professional sports teams that have physiotherapists working on us around the clock, so you can probably add 2 to 3 weeks on those figures for most of us, unfortunately. Now, in terms of possible repercussions of the injury, so 40% of the general population will report some sort of residual symptoms to the ankle, and that's probably because they don't get physiotherapy or they've had another injury and it's not been recognised. But we definitely know that there's up to 5 times the risk of having another ankle sprain, so wearing an ankle brace is advisable because it reduces the risk of you having another sprain by about 70%. So at least for the first 12 months of the injury, it is useful for doing that when you're going back to sport or going back to training. Now, the comment I often get from people is, I don't like the brace, I won't play as well in it. Well, there's actually been a study looking at how it went in soccer players, recreational soccer players, because 27% of them say they'll wear the brace, meaning that most people won't because they feel like their performance is going to be impaired. But this study looked at about 15 women and 5 men, so it's not the largest of studies. And what they did was they basically put them through their paces. So they tested them on shooting, 40-yard dash, and the T-test, which means up, back and side, basically, both with and without the brace. These were soccer players, and what they found was that the results were exactly the same for both sets of groups. The 2 tests were repeated 7 to 10 days apart, and there was no difference. So that suggests that your performance is not going to be impaired. Now, the question I most commonly get is in what circumstances may I need surgery, and that's basically reserved for patients that have got ongoing instability symptoms despite dedicated physiotherapy for up to 3 months, or they have ongoing pain, because really your ankle sprain pain should be resolved around the 4 to 6 week mark. And so you might have another injury such as this one here, and now this photo here is showing what's called an osteochondral defect. So the patient has knocked off a piece of cartilage, and this patient may not get better, they may have ongoing pain. So that might be a reason why it's not getting better. The other is something known as anterolateral impingement, which means there's some scar tissue or some spurs that are on the front of the ankle that are causing ongoing pain, and they may need to be treated surgically. The third is a patient that has heels that point inwards, and that's how they normally sit. And unfortunately, no degree of physiotherapy will improve this, as that patient's likely to have ongoing sprains. And then the last one is what's called a peroneal tendon injury, where you can see those tendons at the back there, they can be injured at the same time as the sprain, so the sprain gets better, but the patient has ongoing pain at the back of the ankle, and sometimes that needs to be helped surgically. So thank you for listening to Talk today. Please take a look at www.hunterfootandankle.com.au and make sure you subscribe and like our videos. Thanks very much. Bye.